Well, good day, everyone. It is my pleasure to welcome you to this NASW Town Hall. Last July, when I took office, actually, we first decided to launch this interactive town hall on racial equity. We set out on a journey, and we're still continuing that journey to be thoughtful, provocative, and sometimes uncomfortable conversations about the state of racial equity from a social work perspective. You see, we believe that racial equity is at the core of social work. Today, we're taking another step in our journey by hosting a part 2 of our two-part series, focusing on abolition. Now, think about why you came into social work. I know I came into social work so people did not need me to help people navigate these systems and take these systems away so that people could uplift themselves and be the best that they could be. But sometimes we forget about the role of social work. And today we're going to hear about the role of social work. It's not to create these cages for people, but to take them away and allow people to perform and be the best that they could be. So this webinar will build on our first event. And I learned so much during that first event, which was on March the 12th. We learned and dialogued about how abolition looks like in practice, the social work's role with the carceral system, and what social workers can do to create a society in which the need for these systems is obsolete. I am delighted to have two really great people on this platform who's going to serve as moderators, Alan Detloff and Laura Abrams. Alan Detloff is the Dean of the Graduate School of Social Work at the university and the original inaugural Maconda Brown O'Connor Endowed Dean's Chair. That's a lot. But Alan is a lot. So he does a lot for our profession. So he should have a title that replicates who he is. Prior to joining the University of Houston, Dean Detloff served on the faculty of the Jane Addams College of Social Work at the University of Illinois at Chicago. He is the co-founder of the Upend movement, a collaborative movement that seeks to end the involuntary separation of children from their parents through abolition of foster care and the child welfare system. And he's joined with Laura Abrams, who's the professor and chair of social work at UCLA's Luskin School of Public Affairs. Her ethnographic scholarship has examined experiences of youth in the juvenile justice system and in the transition to adulthood. Currently, she is also pursuing policy research in the area of youth justice reform. Now, before I move off, I'd like to thank all of you who are members of NASW. And if you're not, I'd like to encourage you to become a member of NASW because it allows us to do these programs, but more importantly, it allows us to change our practice and do what is needed to uplift those who are most vulnerable. So if you're not a member, please join. And for those members, leadership matters. And there's an opportunity right now. Platforms opened, voting open starting April the 6th until May the 28th. I want to be the Stacey Abrams of social work and have you all study who you will vote for and then do what is needed of social work. We ask people to do it all the time to vote, but social workers don't vote themselves. So I need you to go and vote. Put a date down today. And then think about what you hear today and vote for people who can carry out removing the systems that suppress individuals from reaching their fullest potential. So thank you. Join us. We're going to have more to do, but thank you, Laura and Alan. I look so forward to learning even more than I did before. But I also want to publicly say thank you.
Thank you, Mitt. We really appreciate it. I appreciate the very nice introduction and appreciate the opportunity to be with you and partner on this event with NASW. So thanks very much. I'm going to kick us off by just giving a little bit of background and context to how we got here to this webinar series. And as many of you know, this is a really pivotal time in the history of our profession. It's a time when social workers are being asked to take a larger role in responding to some of the greatest challenges we face that have resulted from the ongoing legacy of racism in our society, while also at the same time facing very serious questions about our own history of racism as social workers and the racist outcomes that persist in the systems where social workers largely operate. And specifically how we got here today, this conversation began in summer 2020, following the murder of George Floyd, which of course was preceded and has been followed by the murders of countless Black Americans at the hands of the police. But following the murder of George Floyd, social workers were suddenly in the news as an alternative to policing. And in response to a critical article about social workers and the social work profession that was in the Washington Post and our history of racist outcomes, NASW printed a rebuttal suggesting that social workers are actually best suited to work alongside the police to decrease racism. Laura and I, and many others in our profession, were concerned that the attention to social work as a profession, including from former President Trump, along with what appeared to be an alignment of social work with policing by a professional organization, would distract from what we thought should be a moment for our profession to really stand up with the movement for Black lives and with larger calls for defunding the police. We knew that many social workers wanted to hear a bolder stance from our social work leadership, one that would stand with community, not with the police, which after decades of failed reforms have not ceased to murder Black Americans at alarming rates. So last summer, Laura and I wrote an open letter to NASW and our allied leaders asking them to support the Defund the Police movement and to take seriously calls for abolition among our members. And that subsequently led to our conversations with NASW to hold this webinar series that we're participating in today. So in this series of town hall meetings, this was created in recognition that conversations about abolition of carceral systems that include not just the police, but also child welfare, immigration, and many mental health services. While those conversations may have been previously considered radical ideas or not part of mainstream social work conversations, they're now very much part of mainstream social work conversations. This also comes out of growing and continuing recognition of the harm that's caused by carceral systems and the disproportionate harm that carceral systems cause to Black and Brown communities. And at the same time, the social work profession continues to be confronted with questions about our role in collaborating with and upholding these systems that are known to cause harm. So can we as a profession continue to cooperate and support a system that's responsible for the murders of countless Black Americans, a system that's responsible for terrorizing Black communities across the country? And can we as a profession continue to support a system that forcibly separates Black children from their parents in a racist society, given the history of family separation in this country as a means of establishing power and control over Black families, dating back to the times of slavery? These are the questions that our profession is facing now, and I'm very grateful to NASW for providing this opportunity for us to discuss these important issues. And now I'm going to turn it over to Laura, who's going to introduce our panelists for today.
Thank you, Alan, and thank you for that background. And it's really exciting to see this work evolving and these voices being amplified at the highest levels in terms of our professional organization. So thank you to NASW. I want to bring up on camera our panelists and introduce them. We have 4 panelists today who are going to be talking about abolition and how it works in practice and in research and teaching and various aspects of social work. We have Cameron Rasmussen. He is a social worker, educator, and facilitator, and and the program director at the Center for Justice at Columbia University. He's interested in advancing institutional and societal transformation for a just and safe world. At the Center for Justice, he is working on ending punishment paradigm and promoting prevention, healing, and accountability, and is also currently a PhD student in the CUNY System Graduate Center Social Welfare Program. He received his master's degree from Columbia. We also have Cassandra Frederique, who is the Executive Director of the Drug Policy Alliance. Welcome, a national nonprofit that works to end the war on drugs, which has disproportionately harmed Black, Latinx, Indigenous, immigrant, and LGBTQ communities, and to build alternatives grounded in science, compassion, health, and human rights. During her time at DPA, Cassandra has built and led innovative campaigns around policing, the overdose crisis, and marijuana legalization, each with a consistent focus on racial justice. Her advocacy and all of the work of DPA lies at the intersection of health equity, autonomy, and justice. We also have the pleasure of hearing today from Reiko Boyd, who is an assistant professor at the University of Houston Graduate College of Social Work. Dr. Boyd's research focuses on addressing racist inequities that impact Black families who have contact with the child welfare system, Black infant and maternal health, and youth emancipating from foster care. A primary goal of Dr. Boyd's research is empowerment of the Black community by pursuing racial equity and well-being. She applies a multi-level life course perspective that directs attention beyond individual factors to examine and intervene on the structural level to help Black children and families thrive. Our fourth presenter is Neolis Palomo, who currently serves as the Texas Campaign and Partnership Strategist, with the Immigrant Legal Resource Center. Neolis is a political refugee from Cuba who has been fortunate to call Houston her second home. Her passion for immigrant rights, commitment to reforming the criminal legal system, and experience in community organizing, policy, and advocacy has allowed her to effectively advocate for local policy solutions that address overcriminalization and incarceration of communities of color. Neolis has a bachelor's degree in social work from the University of Houston and also an MSW from the University of Houston's Graduate College of Social Work. Welcome, everyone. Wow, this is quite the experienced panel. I'm excited. So we're gonna just launch in. Just as a reminder to participants, there is a Q&A function and we will have ample time to get to some questions after we have a moderated about 40 minutes. So just as a little bit more background, in part one of the webinar in March, we explored really the basics of what abolition means as it relates to social work and also the systems that we work within. In particular, you could think of it as many systems. Mental health has a carceral aspect, substance abuse, the courts, youth justice, adult justice, or in newer terms, the criminal legal system writ large, and child welfare. But also, if you think about our work as spanning the criminal legal system, it's also in schools and really in most of the places where social workers perform their duties. So we talked about the idea of how abolition can be consistent with social work values. We defined abolition a bit. And we talked about the idea of abolition as presence, not absence, meaning that the work is not simply about ending systems, it's about replacing them with new ways to respond to social problems that center community and healing and accountability. So we want to start part two by picking up on that idea and really answering some of the questions about the nuts and bolts of what this kind of radical re-envisioning does in thinking about social work and where are we imagining ourselves in the future? So I want to start with a kind of general question for each panelist. And here we go. Ruth Wilson Gilmore, many of you in the audience and also, of course, our panelists know her as a matriarch, pioneer of abolition, has said abolition is a way of seeing. Abolition makes us ask, when you look, what are you seeing and what would you rather see? So when you look at the systems that exist today, the carceral systems that are entwined with social work or in the area that you study, what do you see and what would you rather see? Okay, so I'm going to start with Cassandra on that one.
I think when I think about social work and abolition, what I would rather see is care without a commitment to punishment. I feel like so much of our care systems are connected to surveillance and punishment and criminality, and that our system of care is conditional based on the person that is receiving care agreeing with us. And so what I'd like to see is care without conditions care without conditions of conformity.
Okay, okay, wonderful. How about you, Reiko?
Okay, when I look at my area of work, which is the child welfare system or family regulation system, I see inequities that are rooted in and reproduced by racism. I see that they remain at an unacceptable level. I also see and hear the myth of a system as being helpful. And I often hear this narrative that the system is a safety net, and that it's a justifiable means by which families who are underserved should receive services. So I see also the state use of surveillance, of control, of punishment for things that are actually a result of societal failings. So I see a fixation on individual level behavior, modification on blame, pathologizing, and justification of approaches instead of addressing the underlying problem. So I'd rather see the myth of helpfulness dismantled. I'd like to see actual help based on the responsiveness to the truth that the root cause of harm is actually that people are not getting their needs, their basic needs met. Needs for food, housing, affordable and high quality childcare, education, access to healthcare, to clean drinking water, gainful employment, and other social determinants of health, because those are the things that actually keep children and families safe. So I'd like to see a radical imagination of how we support families, how we do that in a way that doesn't rely on separating them, on policing them, on controlling them. A radical approach that's really based on the needs and the dignity and the humanity of families, and to ensure that, you know, families and communities have meaningful supports. We can thrive without intrusive interventions from the state.
Thank you. And Neolis, in your work with the immigration and the criminal legal system, how would you answer that question?
Yes, that's a great question. I want to start by saying and acknowledging that the police force in the United States upholds a system of racialized violence and white supremacy. And the police exists really to protect white people and respond to white fear. That is their core function of the police system in this country, right? So we need more white folks that say that they don't need the police anymore, right? That we don't want them killing, you know, for them anymore, right? We need to start acknowledging the root causes of why we have such a huge criminal legal system today. In the work that I do in the intersection between the criminal legal system and immigration, I see a current criminal legal system that we have been conditioned to see as the sole remedy to everything, right? And it has put about 2.3 million people in cages 1 million more people being deported. Over 70% of ICE arrests, so over 70% of ICE arrests are a result of folks being in contact with the criminal legal system. So we know that if we reduce arrests, we also reduce deportations, right? In Harris County alone here in Houston, Harris County is one of the top deporting counties in the nation. So we have the highest number of ICE arrests across the nation. I also see a punitive system made out of both private and government prisons that continue to harm and oppress Black and brown bodies and other vulnerable groups, including our LGBTQ immigrants, asylum seekers, teenagers, adults, who really face a greater risk of discrimination and coercion and physical, mental, and sexual abuse in custody as well. What I would rather see in our country and in these nations, I want us to collectively reimagine and create a society that enhances life instead of relying on these prison systems of organized violence to solve a lot of the societal problems that we see today. I want us to create alternatives to policing that both empower us to keep one another safe and encourage us to live the lives that are free of violence and oppression. And one of the ways that we can do that is by shifting our perspectives on how we see the criminal legal system in this nation. I want to see a transfer of all resources that the police controls, and I want that money to be reallocated to community alternatives to policing, right? We need to structure a dramatic and fundamental transition from an old system that does not work, has never worked, to a new system that does, right? So when we start reimagining and shifting our perspectives, and we see, for example, we hear our neighbor that is being loud or whatever the case might be, if we hear of any type of domestic violence, what can we do instead of calling the police, right? So I want us to have systems in place that are an alternative to policing. So how do I keep myself safe without seeking protection from a system that is predicated upon the surveillance and extermination of others, right? So I want to see an expansion and creation of other community alternatives to policing by creating like alternatives to policing glossary in different localities. I know Portland has a great glossary of policing alternatives that includes calling a friend, sanctuary cities, restorative justice programs. Again, I also want to see money being taken away from the local police budgets and reallocated to human services agencies and other non-police responses programs like CAHOOTS, mobile crisis interventions, behavioral health crisis response team, and other forms that does not require police, right? And the only way that we're able to really sustain that is by taking away the millions of dollars, and here in Houston, billions of dollars that the police gets, right, in order to sustain other forms of programs. And I just want to continue seeing other forms of restorative justice initiatives. And I just want to end by saying that abolitionist principles understand that nothing good will ever come out of continuing to rely on the current racist prison industrial complex that we have in this nation. So even when the state, right, only offers incarceration as the only option when one of our loved one has been hurt by the system, we know that putting folks in cages is not the answer. So that is the abolitionist principles that we should continue to practice. And an abolitionist framework would try to really, it's very similar to what we are trying to do as social workers, or we should be doing as social workers, should I say. A framework that would try to really locate and understand the underlying and long-standing societal problems, right, that encourages different type of white supremacists and other types of violence that occur in this country, because we know that this really unfair criminal punishment system that we have will never, we could never trust it to provide equal justice, because it will never do that, right? So those are the things that I would like to see and that I would like for us to practice as well.
Thank you. Cameron, do you have anything to add on that? I heard from many people some really interesting tidbits so far, and I don't want to lose them. But being, less harmful, we want to re-envision what safety means, we have to allow a dismantling of white supremacy or we have to work toward a dismantling of white supremacy for abolition to occur. And what we'd rather see is a social work rooted in care and community. And so, yeah, so far, and I've heard more, but that's a little bit. So do you want to add anything there on what you'd like to see?
Yeah, hi, thank you for having me. It's really exciting to be here. The thing that I'm sort of thinking about in terms of this question is, so Cassandra and I were part of a group called Social Workers Against Criminalization, which started in 2015, and we lasted for 1.5 years or so, and we had great ideas and lots of ambition and very little capacity. And but there wasn't, I felt like it was a very marginal sort of, it was at the margins of social work. And now we're 6 years later, and this term carceral social work is something that like people are beginning to know much more clearly. And so like being able to see how deeply invested social work has been in carceral systems, I think has been fundamental to then allow us also to say like, what do we actually want instead, which is partly what your question is predicated on. And I think the thing that's been most compelling for me about abolition is that it like asks you to sort of look at and figure out the world that you want and then figure out how to get there. And the other thought I had about this question is like, it feels like social work as a profession has like been trying not to lose instead of trying to win, if we're thinking in terms of like people, like the people's welfare and wellness. And the other thing I would just add is like, the thing that I'm seeing that like really moves me and speaks to the kind of social work that I would imagine and want is like the way that survivors of violence, of state violence, of intimate personal violence, of violence in general, are sort of grouping together and working in solidarity to say this punitive dominating system is not what we want. And like for me demonstrates like solidarity, self-determination, and care. And those are some of the things that I feel like are values and words, but also deep practices that are important for a social work that we want, or that I want.
Thank you. And I'm gonna pivot a little bit and ask you a follow-up there, Cameron. And I think this is a really key question for NASW and for this webinar. And that is the difference between reform and abolition. So, you know, criminal justice reform, an area you and I both work in, is popular, right? The right likes it, the left likes it, the liberals like it. It's kind of like, yeah, we have a problem. Let's reform, right? Child welfare reform is popular. Reform of the juvenile justice system. We hear about, you know, school policing reforms. A lot of social workers are probably very attracted to reform. Even our early pioneers, the white women of Chicago, were the social reformers, right? And so I guess one thing that would be really important would be for to distinguish what is reform versus abolition. Are they related? And yeah, what do you think about that?
Yeah, I mean, there's now sort of endless amounts of things that people can read about prison industrial complex abolition. And so Mariam Kaba, Ruth Wilson Gilmore, Angela Davis, Dean Spade, the list goes on, and there's all you gotta do is sort of Google that and you'll find a bunch out there that helps define both the theory, the practice, and the sort of politics of PIC abolition. And then, you know, there's reforms that, and we sort of have talked about this previously about non-reformist reforms and reforms that are sort of re-entrenching the system that we have. And so it's not that reforms aren't a part of abolition, but abolitionist work is pushing for more liberatory reforms that get us closer to that horizon. So I think part of what abolition does is it demands that we think about the world that we actually want. And the world that abolition wants is a world free of prisons, police, and punishment, which is very difficult for many of us who have like been socialized to think that that is a normal part of society. and that is actually a helpful way to deal with harmful behavior or social problems. And the more that you learn, you realize that actually has not helped us with our social problems and has created and exacerbated the social problems that we already have. So to say that like reforms are a part of abolitionist work, but there's this term non-reformist reforms or liberatory reforms, which help us think through the path to getting to the abolitionist horizons. And I think when we think about social work, there, like, many of us have worked in and around jails, prisons, and some in police. And I think we're going to talk about this, I think, a bit later, but one of the abolitionist step, I think, is to say social workers should not be working for police, prisons, jails, punishment, period. Like, it should not be working in police departments. It should not be working in jails and prisons for departments of corrections. Then there's another piece of like working in and around them for nonprofits, which is another layer, which I think we'll talk about. But I think that's an abolitionist step, to say like we should not be legitimizing these systems by working as an employee of the systems.
Mm-hmm.
One last thing, which is that there are questions that Dean Spade and others have laid out to help us think through the kinds of questions that help us understand whether something is more liberatory or not. And there's a group of us who are trying to sort of adjust those questions more specifically for social work. So
Interesting. That's like, I wish I could capture what you said and like make a slide out of it, because I think that's where a lot of times social work gets tripped up in this conversation is, well, you know what, I'm gonna advocate for reform because I have clients right now who need things, you know. Does anyone want to add to that question about reform versus abolition? Or Cassandra, you were nodding.
Well, I tend to agree with Cameron, but what I would say often about the reform versus abolition is, I think the framework that folks at Critical Resistance have put forward is important. Like, do your reforms add to the carceral system, or do they take away, right? Like, are they shifting? Are they redistributing power? And I think oftentimes, so for example, for us at Drug Policy Alliance, we know that overdose is happening all across the country, and it's happening in jails and prisons. And addiction is happening in jails and prisons. And we actively work to get medication treatments inside, right? And there are those in abolitionist spaces that say you can't invest in the healthcare of people who are inside and be abolitionists. You're just adding resources to that entity. Right. I have a very hard time with that. I actually reject it, because I feel like if we're trying to take the bars down, if everyone is dead, who's coming out, right? And so for me, I feel like if the reforms I'm fighting for aid the material wellness of people inside, that to me is important. Now, if you're talking about building a new wing of all these different things, and I think there are conversations where you have to ask yourself critical questions about, so for us, we work on making sure that folks inside can have access to medication treatments, but we're also working on decriminalizing drugs because we actually don't think those people should be there in the first place. And it's about doing both. And so I think it's really important about building an abolitionist strategy for the reforms you're fighting for.
That's great. I mean, this is so helpful because I think these nuts and bolts questions are, you know, what comes up a lot for social work practitioners and students and scholars as we're delving into this, like you said, more popular discourse at this time, right? That actually leads us well into my next question for Reiko. So you teach social workers, you train social workers, many of whom work in child welfare and related carceral systems, or who are planning to. What do you say about how to work toward abolition, even from within? What are your thoughts about this? And what do you say to social workers who are launching their careers?
So this is a great question, and this question of, what do we say to social workers who work within carceral system? It's really a question for all social workers, whether we work in carceral systems or not. As social workers, we work in and within systems, so it's a relevant question for all of us. And I would just start by saying that, yeah, as you pointed out, I teach social workers. I'm an assistant professor. I've been focused on the problems of what we call racial disproportionality and disparities in the child welfare system, where I've been focused on that for quite some time, but I'm actually new to this conversation and I'm new to this work. And so I'm humbled by the opportunity to participate. There are others who are way more qualified than I am, thinkers and doers organizing on the ground who've been doing this work, whose voices are needed in this space. But I am actually hoping to speak about what I'm learning, to share where I am, and I'm hoping to strike a chord with people like me, those who are striving to do better as we come to know better. And so I have asked myself the same question. I'm continually actually asking myself this question, and that's also part of being part of an institution of higher education. We have to ask ourselves these questions as well. So what I can say, where I am and what I can say is, in my view, the first and foundational work, the form of work that needs to happen is actually getting an understanding of what it means to work towards abolition. Abolition is not new in a child welfare field, and for many of us doing research and who have a certain background of training, certain things may be new to us, but it's not new, and not even in the child welfare context. Many have been doing this work, and I see it as my and our responsibility to get an understanding. So abolition theory was not part of my formal education, was not part of my undergraduate work, was not part of my MSW curriculum. No mention of it in my doctoral studies or my training as a researcher, my training as a child welfare CPS worker, which is where I started my practice background. So what do I do now? Now I must engage in a process of re-education, right? I have to engage in a process also of unlearning, of correcting my education, and filling in gaps that are left by mainstream institutions. So by gaining an understanding, then when we do that, we can better discern. We're then able to ask questions about what steps I can take toward abolition. I can set a more meaningful scope of the questions I can ask to understand how to effectively target advocacy. And then when we do that, we can engage in coalition building, which is also essential, coming alongside others and engaging in collective learning. We can study together, creating study groups, reflecting with one another, joining in existing efforts, and then also considering new avenues where needed. So I would just say this, that's an answer that I would give, and I think that it connects well to what Cameron mentioned, because I really know that regardless of all that in that process of learning, many of us will have to grapple with the reality that when we ask ourselves this question of, can I work toward abolition from the system that I work? The answer may be a resounding no. But I believe we have to, someone can tell you that, but you can tell yourself that. But you have to it has to be a process. It's a process of getting to that place. So
yeah.
Answers.
And one thing I see in the classroom myself over the years and in academia is an increasing acknowledgement that, yeah, these are, different views, and we need to ask social workers to think critically about these various standpoints and who they want to be when they enter the field as a leader, as a scholar, as a practitioner, as a policymaker, right? But without even presenting radical change or abolition as a framework, then people don't know about it. Like you said, right, Go, you didn't learn, you know, in your programs about these texts, right? So why aren't we reading Angela Davis in a policy class, and so forth? So I think those are some great points. We're having a little trouble with your audio. I'm not sure if we can work on that when we come back to you. I'm gonna move to our next question, which also, you know, we just talked a little bit, and Reiko talked about learning, okay? And as we've been in this space of like collective learning in social work and thinking more about perspectives on abolition, it has become divisive at times, not just in the general public, but specifically within social work. And you can kind of see this on blogs and around the election and policing, and, you know, if you read the NASW Facebook comments and such. So, Naolis, you know, you work in this space and you are also educated at Houston. Why do you think this conversation has been divisive within our profession? And what do you encourage in terms of this idea of kind of co-learning and struggling together rather than against?
Yes, that's a great question. I think the conversation about abolition has been divisive within our field because of fear. I think that is the root of what is happening, right? Because it's hard to, sometimes it's hard to sustain two truth at the same time, right? The complexities that come when we have to critically think about, you know, the different perspectives and the different ways of living. Sometimes that causes a lot of discomfort and a lot of fear for a lot of our social workers and people in general. And something that Reiko mentioned earlier is that a lot of these things, right, a lot of these texts, a lot of these principles are not really taught in our curriculum, right? It's not part of our field practicum either. You really have to kind of seek outside of it, right? And which is, to me, is very interesting because the values of social work, a lot of it, right, aligns so well with the abolitionist framework and principles. So in a way, we are doing that, but we're not naming abolition because oftentimes it can be too radical, right? It's too bold to say those things, even though if you study the profession of social work and you really want to dismantle the system and get to the root causes, right, of these issues, then you know that, you know, we have to practice an abolitionist principle. So I think a lot of it has to do with fear. And I think that some of us that are practicing, you know, with at a micro level with individuals, I think that we also see folks that are survivors of domestic violence, right? We see a lot of folks in our LGBTQ community that are also attacked, right? So we're like, no, we need the police, like we need them because they're here to save us, right? They're the only system that is in place, right? That we're being conditioned or accepted, right? To solve all of these issues, right? And because of that socialization that we've all been, you know, part of, it causes a lot of fear because there's not an alternative to policing right now, right? Or there are, but they're not many and they're not well funded, and we need to do more research and we need to do more, right, to expand those alternatives to policing. So a lot of times we feel that, you know, the police is the sole remedy, right? Like, and also a lot of the systems like are intertwined. They work with, you know, with each other. And one thing that, for example, in the immigration world, you know, in order to qualify for a U visa, right, and to get some type of immigration relief through a U visa, if you are a survivor of domestic violence or any type of violence that happened to you in this country, you have to file a police report. Like, you have to have a police report. Like, literally the systems like force you to utilize the police. right? And then if you don't have that, right, and oftentimes the police don't even want to give you any type of report either, right? Because they know that, you know, a lot of them don't like immigrants, and a lot of them don't want to, you know, give that report. So we see that a lot, that, you know, even the government systems that we have in place force us to utilize the police, right? And what are the other options that we have, right? So there's a lot of fear, because oftentimes we think that that is the only option and that we should stick to that instead of trying to reimagine something different, right? And think of other alternatives to the systems that we currently have. So I think it's really feared. And some of the things that I would challenge us as social workers, as practitioners, as policymakers, is to really think about the foundation of social work, right? There's a famous quote by Ruth Wilson Gilmore that says, "Where life is precious, life is precious." And to me, that quote, I should actually have it in my house. That quote is exactly what I see social work being and what I see abolition being. And I know abolition, it's hard to define it because it's plural. There's so many definitions of abolition, but to me, where life is precious, regardless of what has happened, regardless of what this person has done, right? So to me, that quote ties perfectly with the social work code of ethics, right? And it ties to a lot of the practices that we should be doing, right? So I would challenge us to think about that, to think about how we can actually practice that in our field, right? And as Cameron mentioned earlier, there are tons of books, podcasts, blog posts, so many things about abolition now since last summer that have, you know, come up. And abolition is nothing new, right? If you learn about the history of abolition, which is something that I would encourage all of us to do, in order to really honor the history of abolition and where it started from, you know, you want to be able to do your work and your research, you know, to be able to really practice that and honor that, right? Just don't say that you're going to be an abolitionist and then don't understand the history and don't understand how to actually practice it, right? Which is something that we're all trying to learn. So I would encourage us and challenge us to also read, listen to books, podcasts, blog posts, talk to, you know, your colleagues, encourage your graduate program or your undergrad program to do more, you know, to do more lessons and more curriculum about abolition, so you can learn a little bit more about how to actually, you know, practice it as well. I'm working right now with the ILRC is working with an organization called Latino Justice, and we're hosting different type of abolitionist conversations, workshops, and we recently created an abolitionist resource guide that we'll be happy to share with folks listening to us today. And the workshops are called Abriendo Corazones, and that means opening hearts. And to me, it's also what, you know, what abolition and social workers should be standing for. So those are some recommendations that I have for us.
Thank you. Cassandra, did you want to add to your idea about divisiveness and how to learn together?
Yeah, I affirm everything that Naomi's just laid out. And what I would say is that I think it's also important for us to look at the history of social work of white women taking Indigenous kids and putting them in homes because they thought that the homes of their family members were inappropriate, right? Like the foundation of social work was not racial equity, right? There is a foundation of whiteness. And so inherent in the conversation around abolition, because part of the presence, not absence, is also about power, right? It's about the sharing of power. It's about creating co-governance. And in a profession that is about helping is not about sharing power. And so I think inherent in the tenets of social work, because we talk a lot about the code of ethics gives us a lot of room, but if we talk about the tenets and the history of social work, it is very clear why this would be a divisive conversation, because there are people that are committed to the tenets, and then there are people that are committed to what the aspiration of social work is. And so I think that this moment, if you're looking at the tenets of social work, people are like, absolutely, we should be working with the police, because we are going to help them be less racist, and we are going to help the people that called, right? We want to help them. And then you have people like some, us on here who are like, they should not be working with the police. It's because our code of ethics says something different, right? And so I think the very institution of social work, and this is where Cameron and I agree on a lot of things, and this is one of our divergent points, where I believe that in the world that I want to create, social work doesn't exist, because I believe that the tenets of care would be shared across and people would have what they need. But I think in order to get to the world where social work doesn't exist, social work is responsible and is a big actor to get us there. And I'm not talking about tenets of social work, I'm talking about the aspirational social work. Like the code of ethics kind of social workers can create the building blocks. Because the thing I learned at social work school was we want to work our way out of a job, right? Like social workers say that all the time. We should be working to work ourselves to build the world so we don't need the field. Because remember, social work is a Band-Aid. It's supposed to be helping people when they are in distress. And the world, if I want to imagine a world that has no distress.
Let me ask you a quick question about that. I'm sure this might come up in the chat. Is it too idealistic to think that, even in a world that has fewer carceral systems and community empowerment and more opportunities for healing, that we still don't have a lot of interpersonal strife or mental health issues or violence that just where social workers could still play a role in that healing? Would that be,
Well, I think you should ask Cameron that question.
All right. Because I tend to feel like I can see the route toward abolition, but I kind of still see a role for social work, but I'll ask Cameron that.
I mean, I'll say one thing. This has been a long sort of conversation with Cassandra and I that will continue far beyond today. And I'm it's a grappling thing for me to like really, I'm confused isn't the right word. I'm grappling with what is the social work that I think I want in the world, if anything. My mom, I think, is watching, and she's a couples therapist, and I think she's like supported a lot of people in their own sort of better relations, and I think there's value in that. As someone who's gone to therapy a lot, I think there's value in therapy. When I think about social work, that social work that I like, the aspiration is like, one, it's about people's welfare, like, and people being well, and like not just these sort of segmented, like we're good at being therapists, which is something we offer that I think is useful. I think we're so far from it, and like over at least the last 40 years, there's the longer history, and I'm not a historian, but at least over the last 40 years, like the way that capitalism, racial capitalism, has like been central to what social work is and does, has made it to something that, like Cassandra's like, this is not working at all. It's not going to work, period. And I think what I think is beautiful is like I teach as an adjunct, and I'm fortunate to teach this half semester course on abolition and social work right now for like, it's whatever, a select group of students, but their expectations are like, this is like, what have we been doing? Like their leadership is what's pushing something to be possible that wasn't possible before. So I'm grappling. There's some part of me that maybe it's self-interest, maybe it's like the belief that we have some role to play, but at the end of the day, it could be that we don't. So, and shout out to my mom.
Well, hi, Cameron's mom. Glad you're here. And yeah, I mean, I would say that's an open question for me as well, and something I'm grappling with within this new era that we're in terms of social work. And I'm excited about these conversations precisely because if we come at this thinking, you know what, we're all like, yes, social work values are very consonant with abolition values. A lot of the controversy or the spaces in between is like what happens in the interim and what will happen to social work, right? So those are a lot of the conversations that we need to have, that we're having now. I want to leave time for Q&A and bring Alan back on because we're right at time. Welcome back, my friend.
Thanks, everyone. Actually, we actually have a really good question from the audience, kind of related to what you just ended with there, Laura. You know, a lot of times I think in these conversations about abolition, it's easier for people to envision this future, but the idea of the interim comes up often. So this question here is, don't we need something new in place before we abolish something? Anyone want to take that?
I think it's a false choice. And what I mean by that is I think we can do both at the same time. And I think often part of white supremacy culture is perfectionism, which is really hilarious because what we don't have a perfect system right now. And so I think one of the things that abolitionist giant Miriam Kaba says is try everything. And so for me, I think one of the things is we know that cages don't deter harm, and we know that cages don't rehabilitate people. So if we know the thing that we are currently doing isn't working, then why wouldn't we try other things? And people are like, we can't try other things because what if someone harms another person? I'm like, they're harming people now. Literally harm is happening right now. So how do we can't, it's interesting because this question comes up all the time, but this is going to be very, probably crude, but what I would offer is that question, if that question was true, Haiti would not have been the first country to fight for its revolution, right? So 1804 of us being free, we're still figuring it out, but we knew that we could, that the issue of being enslaved was so urgent that we fought through, and we're still figuring out our republic and our democracy. And there are a lot of reasons it doesn't work, but I will never answer that Haiti got its freedom too soon, that we got our liberation too soon. And like, that is my ethic around, like, sure, like we could close all prisons right now, right? But maybe we can't, but why? There's nothing stopping us from trying to build the new things as we try to tear down. And so, you know, one of the things that I would offer to social workers is start building the new thing. If you work for a foster care agency, sure, that's your 9 to 5, but you should be organizing with families on the outside and figuring out how we can do the education and build the alternative structures. I think we need to do them at the same time. And I think oftentimes people are waiting for something to happen. And as a Black person in the US, as a Black person that parents are from Haiti, I'm very clear that you can't do it when it's perfect. You have to do it because it's urgent.
Yeah, great response to that. Another question kind of related to that in terms of thinking of examples, someone asked, are there other countries that have either established systems or other ways of addressing these issues that we can be looking to as best practices?
I want to jump in and just say something about the last question if I can, which is people want, I think I hear often like a desire for alternatives that are scaled at the size of the criminal legal system, which is so massive and is like never, what we want is not anything near that size or that sort of professionalized, criminalized, siloed thing. Cassandra referenced Miriam Kaba, and Miriam has helped to build this thing called 1,000,000 Little Projects. And like more than half of people who are survivors of violence don't actually call the police right now. So people are already trying to figure it out. It's just not these visible sort of professionalized state alternatives, which is why I think Miriam Kaba also talks about, like, we don't want alternatives, we want something completely different. And I think that's partly about building in your own community and building solidarity so that people are around you when things go wrong, instead of just going to a system that many people don't rely on already. The one thought about the international piece is, like, you know, the Nordic countries have a prison system that is more humane. The question of, like, is that a good thing, period? Maybe, but it's such a completely different set of circumstances and realities. And as like more immigration is happening in Nordic countries, we're seeing the way that system isn't so humane to people who are the other, and our country is full of that. So that's one thought there.
Anyone else know of other examples? We have a number of questions. One is related to international, but another question just asked that are there examples of restorative justice programs that can be scaled up? So are there examples to give to people that they could learn more about if they're wanting to bring something, say, to their community?
What I would say is I'm not clear on that, but I would say that part of abolition is decriminalization, and there are international examples of decriminalization. So in my sphere, there's the decriminalization of drugs that have multiple international examples. And so the one that everyone has talked about is Portugal, where they removed criminalization for small amounts of drugs and created dissuasion courts where people are connected to health providers. And what they saw was a decrease in criminalization, a decrease in overdose, a decrease in bloodborne infections, an increase into access to treatment and people actually getting into treatment and doing recovery. And so I think this is one of the things where I say, like, I feel like sometimes folks get overwhelmed because abolition is so big and also so amorphous, and it's really about taking apart one piece. So like figuring out what your lane is and how you can provide something different. And so I would look at some of the spaces for some of our most marginalized populations, people that sex workers and people that use drugs. I think there are abolitionist kinds of reforms that are happening internationally that we should be looking at in the US. And the decriminalization of drugs and the decriminalization of sex work are big things, are big community-based demands that are happening in the US, and social workers should contend with that, as they're both populations that we work with.
Thanks. We have a number of questions. Nyla, did you want to add something quickly?
Oh, I just wanted to add that there are multiple restorative justice initiatives that are happening across the country that we are learning more about and trying to do more in-depth research on too. But we know of different community-based sexual assault like centers that have like merged in the past few decades, right? I know Portland is one of the localities that has some of those things. Here in Houston, they're starting the conversation about having like a CAHOOTS program or the mobile crisis intervention program, and expanding some of the mobile crisis intervention programs that currently exist here, and also expanding offenses, right? Not just only for certain offenses, but really include a lot more offenses and not just, you know, minor offenses as well. So there are certain programs that are developing across the nation that we need to learn more about, right? One of the examples that I shared earlier about the Portland like Rose City Cop Watch list that they included, it includes a lot of restorative justice programs and centers in their own localities as well. And a lot of these things, right, one of the things that Cassandra mentioned is like, we want to think about programs too that are taking away, you know, and a lot of discretionary power and a lot of resources, right, from policing as well. One of the things that we work here in Texas and in Houston and San Antonio are a cite and release program, and this it's not an abolitionist program at all, but it is taking away discretionary power from police officers, right, for certain citation eligible offenses, right? So by working with programs like that and trying to implement certain policies like cite and release in different localities, we are, slowly taking away a lot of that power from the officers as well. So that is something that we want to see happen across Texas, because this law is actually a 13-year-old law here in Texas. So we need to make sure that other localities across Texas are enforcing it and utilizing it across the different jurisdictions.
Thanks, Nialis. And then I think this is a good place to get your thoughts on as a closing. We have a number of questions that are asking specifically about the role of social work education. And you've addressed that a bit, or the lack of content about this in social work education. So one person's asking, what are the specific shifts that need to be taken in social work education to change the minds of social workers to live up of our aspirations for abolition? And then another one is more specific. Should social workers advocate with the Council on Social Work Education that curriculum be required to include an abolitionist perspective? So I'd love to hear your thoughts about that.
I'll weigh in on that. The answer I would resoundingly give to that last question on advocacy with NASW or Council on Social Work Education. Yes, absolutely. Yes. When we take a step back and look at it, I would argue that it's an ethical responsibility of our profession, and we have to ask ourselves why would we resist? Why, knowing what we know now, why would we refrain from revisiting the curriculum, from having the accreditation body of our profession stay the same in times like this, moments like this, knowing what we know is not acceptable? We have to continue to push forward and to not reinforce the same inequities that we purport to be seeking to eliminate. And I would say that that would be a key area where we can impact the process of learning for our profession. And so I think that's the key step. There's a place for individual level instructors, faculty members going on their own path to integrate information into their courses. I would say, sure, there's a place for that, but that's not an institutionalized way of creating change. So, and it's not, I would argue that it's not sufficient. And through my time in the GCSW, I know very well the power and importance of leadership and spearheading these approaches and changes, and grappling with that at an institutional level, at university level. So it's extremely important, and I just want to speak to the last part of that.
Yeah, thanks, Ariko. And Cameron, I'm interested to hear what you think. You mentioned you're teaching a class. I've seen a number of other universities or social work programs that have integrated courses on abolition. What needs to happen to make it more institutionalized so that it's not just a course, and it's usually just an elective course that people have the option of taking? What should happen in social work education?
Yeah, I mean, these are just thoughts at the moment, so they may change. I think I'm very happy and grateful to be able to teach this class right now, and I think more of that is great. I think curriculum is great. I'm personally not invested in CSWE, for example, making this part of the required curriculum. I think the deep sort of study and practice of abolition, to me, makes me question and resist the way that our institutions of higher education and our professional bodies are set up, which are exclusionary and expensive and are very much enmeshed in sort of racial capitalism. I'm using this whatever jargon, but I want sort of higher education institutions and professional bodies, if we're going to have them, be really committed to liberation, not just from the content, but from the way that we move and the thing that we're aspiring to. And I'll just say something more concrete about that, which is many social work schools, in my sort of read, have become highly concerned about the sort of market share of students, and the schools are growing and growing and growing. And to do abolition is both deeply internal and deeply collective. And on the one hand, I want to sort of celebrate the success that's happened over the many years, especially the last 10 years of organizing from students to push schools to be better. But I think there are institutional things that need addressing that are longer term work that are difficult. And so I'm yes curriculum, but yes to more.
Cassandra Nailus, any last minute thoughts on that?
Yes, I would actually like to add to Cameron's point on that. I agree that the way that I see us practicing abolition looks to me different, right? And we need to really start critically thinking about how we stop really monetizing from Black suffering, right? And if we do that, I think it's for people that are able to go to school and able to go to get a higher education, I think that it's great. I think that is great. However, I think it is really important for us to really stop monetizing from Black suffering as well. All of this information should be available really to everybody, right? And the way that I see us practicing abolition, I see that both from a personal level, from our work, from our institutional level and organizations, right? So from a personal level, what are we doing to learn more about how we can practice abolition, right? What are we doing within our communities, within people that have been doing this for many, many, many years, right? Because again, this framework is not new. So how can we continue to learn and create spaces within community, right? To learn from one another, to create those environments, you know, amongst ourselves. How can we do to join, like Cassandra mentioned, yes, you might have a 9-to-5 job, but what can you do outside of that too, right? To be able to attend coalition meetings that are trying to do things locally, right? Everything to me starts locally. And where are we investing in shopping, right? I think to me that is a pretty big thing, because to say that we're abolitionists and shopping on Amazon, that I have struggles with that, right? And I understand that Amazon is an entity that makes it really easy for us to shop there, right? But how is that entity treating their workers, right? What are they doing to really dismantle the systems, right? So to me, where we invest, where we shop is also a pretty important piece of this as well. And from an organizational level in the nonprofit industrial complex that many of us are part of, I always think about the fundraising practices that a lot of these nonprofits do, right? Because a lot of times what happens is that the nonprofits are just really following an agenda that is coming from donors, that is coming from funders, right? And it's the same repetition. It's this top-down approach. This is what, you know, these funders want us to do. So then that trickles down to the nonprofits, and that trickles down to the communities we're trying to serve, right? So to me, it's all about what can we do to do more of a community-centric fundraising practices? Like what can we do to change that? Because this cannot continue, right? And really, if you want to look at philanthropy and really understand how it works, it's really a big bank of a lot of white wealthy people giving money to this big philanthropists and big funders for them to then get a tax break and for them to participate in capitalism as well. And then they give all this money to nonprofits, right? And then we are being complicit. We are being complicit in a lot of these practices. So I think it's critical that we as an organization are looking internally to see how we can actually dismantle those practices within our own work, within academics, right? What can we do to really dismantle that, to then be able to go to, you know, the state level and dismantle all of the corrupt systems that we have in place.
Thanks.
Quickly, the thing that I would say is, I also think we need to change the caliber of students that come into our social work schools. I really think that social work needs to raise the bar on critical thinkers who don't want to be cogs in the wheel, who want to disrupt. And I feel like there has to be a way for us to test that. And so if we want our schools to be places of innovation and experimentation, as well as places where we can actually imagine radically, then as a student of color in social work schools in New York City, I can't be in the same class with someone who's like, this is the first time I understand why Black people are poor, right? Like there is a lot of harm that is happening in our institutions. And I think that if we want, it depends on the inputs. And I do think that there's a place for people to learn and to grow, but I think we have to figure out the proportions, because there's a small group of students that are in our social work classes that are being used as a way to teach other students. And it is extractive, it's racist, it's deeply damaging and dehumanizing. And if we actually want to move to aspirational social work, we need to make sure that our social work schools are places for students of color who are coming into these social work schools to build the thing that their communities need to thrive. And that can't happen if they're fighting against students in the room that believe that their humanity is not at the same level as theirs.
Thank you.
We need a social work education. Another discussion.
Yes, thanks, Reiko. Thanks, Reiko. I want to thank all of our panelists. You all were amazing today. We want to invite Angelo McLean, the Chief Executive Officer from NASW, up to give some closing remarks. Angelo, are you there?
You asked, and here I am. Thank you. I just want to really thank the panelists. You guys were terrific. We obviously have to keep having these discussions, keep having forums so we can continue to work. I wanted to highlight just a few things that jumped out at me, and while I'm highlighting these, I'll try to give each of the panelists a little bit of love. I'll say love, but really, and I'll start with Cassandra. What you were talking about. We want care. We want to be able to provide care, compassionate care, without the conditions of conformity, without the conditions of punishment. I love what you said about being strategic in our abolition work, because there is a balance that we need to seek. We're trying to figure out ways to share power, and that's probably part of our problems. Is we've relied on coercion and not ways of sharing power. And I like what you said about, let's not be intimidated by, we don't have the new system built yet, so we can't sort of run the old system and build the bridge. And you said, let's just kind of get out there and do what we can, piece by piece. Rico, you're talking about dismantling that myth of helpfulness. And, we talk of our systems if they're extremely helpful, and when people don't get help from the systems, it's somehow their shortcoming of not being able to take advantage of those systems. And it really, as you were talking, it gave me thinking about, the so-called safety net, and what can we do to reimagine the safety net and make it truly, maybe we don't even need a net, but truly where we got resources further upstream. Naolis, your discussion about just a reminder that policing, its origins were out of a white supremacist system, and we've seen so many examples where people, a white person can pick up the phone and call and say, "There's a black person in my neighborhood," and that or immediate response of, "Oh, we've got to check, we got to protect our white citizens." Cameron, I love that, you say you're grappling with, struggling with, sort of, maybe I don't have the exact answer, but I'm going to keep, stand in the abolitionist swimming pool, I call it, and I'm going to keep grappling with this and struggling with this. And Laura, when you jumped in and said, we don't want, as a profession, we want to struggle together, not struggle against each other. And I think that was really, when we came together and said, can we work together? That was a really good thing to be able to do. There's a lot of work there that we need to do, but when you ask that question about what's the world that you would imagine, and I think we're all saying we want to imagine a world where people needs are met, and we can, as a society, kind of predict folks that might need a little extra care up front. And we always talk about trying to provide care further upstream. We know the further downstream we get, the more coercive, the more oppressive the solutions are, because we're relying on force, locks, institutions, and as we think about the abolitionist work, it's about oftentimes when I've thought of abolitionist work over time, I've always kind of immediately go into, it's about tearing something down. And one of the things I'm learning from you guys is no, it's about building. It's about building things, about building, better societies, better responses, better solutions. So I thank you for that. And I want to thank all of our participants who joined us today, and thank you for participating. And hopefully you will stay tuned. Unfortunately, we've seen a spike in hate crimes against Asian Americans and Pacific Islanders. And we as a profession have to stand in solidarity and let folks know that that's not acceptable, and that we're going to work to find solutions to end these hate crimes. Our Asian American brothers and sisters are residents, permanent residents, contributing residents, and citizens to our society. They're not transitional citizens or transitional residents, and they have been falsely accused of things that particularly as it relates to coronavirus. I don't want to get myself upset as I get to getting into this, but we're actually going to do a similar forum in May, looking at the issue of Asian American hate crimes and what we can do as a profession. And I probably should not end on what I was about to end on, and just sort of say, remember Dr. Joyner, president of NASW, she encouraged all NASW members to vote in the national elections. We want to get as many of our members to vote. This is your chance for democracy within the profession, to make sure you have the kind of leaders at the national office who are on the national board, who can lead the profession and the association in the right direction. And I'll end with something I learned from you guys today, a quote from Ruth Wilson Gilmore. Where life is precious, and all life is precious. And thank you guys for what you've done to help further the abolitionist perspective and work within social work. It's very much appreciated. And with that, we'll sign off and wish everyone a good day, a good weekend, and a good month. And it's no longer social work month, but we can still pat ourselves on the back for being good social workers and doing a good job.
Thank you all.